Pfizer kicking off the week with some potentially great news, saying their vaccine is showing promising early results. In a press release from the drug company, they said that their inoculation shows a 90% success rate against COVID-19. With more on this, I want to bring in CTV News medical contributor Dr. Marla Shapiro. Good morning, Dr. Marla. So this is an mRNA vaccine. Tell us what that means.
So this is brand new technology. It stands for messenger RNA, and what it does is it's injected intramuscularly, 2 injections, 21 days apart, and it induces a protein that looks like the spike protein on the coronavirus, and then your immune system responds to seeing this protein by mounting an immune response, a fight, if you will, and that induces antibodies so that when it sees the real spike protein, if you are exposed to coronavirus, you already have existing antibodies to fight it off. And that's what most vaccines do with different types of technology.
Okay, so Pfizer says it's 90% effective. This is pretty incredible. What data are they releasing to back that up?
So we have very little data. We know what the numbers are in terms of who was in the study. We imagine that most of the cases of coronavirus that were seen in the placebo arm. We don't know about the cases that happened in the vaccinated arm. Did it attenuate illness? For example, if you got the vaccine and got corona, was it a milder case? We're lacking all that data. And we really are looking at data that is about 2 months old in terms of safety. So that's very short in vaccine worlds and vaccine history. Normally, we develop vaccines over the course of years, not months. But in the short run, very few side effects are being reported, and good immunity is being reported. 90% is very high. That's typically as high as the type of immunity we see, for example, with a measles vaccine, where you get 97%. Typical flu vaccines, we get about 40, maybe 60% immunity. So if, in fact, it's 90, that's remarkable.
It is. Okay, so the drug company was testing patients for COVID-19 if they showed symptoms. So is there still a chance that those who received the vaccine during testing had the virus but no symptoms? How will they know for sure that they protected against it?
So until we see all the data, we've seen the protocol in terms of how it's been done. We know they studied individuals who were as young as 18 all the way up to 85. We know that they represented ethnically diverse populations, but we just don't have that data because we haven't seen a peer-reviewed study yet. We just have the press release that we've all seen.
Okay, and of course, we're all hoping and praying to get life back to normal, and we know that a vaccine is necessary for that to happen. So when we do get that vaccine, who should be the first to get it?
So we look to our National Advisory Committee on Immunization Strategies, NACI, who typically tells us about vaccines, usually not who should get it, but about the vaccine itself. And what's being suggested is people who are at high risk of severe illness or death. So you think about people in nursing homes, people with severe comorbidities, hypertension, obesity, perhaps diabetics, hard to know. Those who are likely to transmit to a high-risk population. So, for example, people who work in nursing homes, essential workers, physicians, nurses, essential to maintaining the COVID response, first-line workers, for example, people who run our grocery stores, those who contribute to the maintenance of other essential services, or those who live and have working conditions that put them at higher elevated risk, perhaps an indigenous population, people who don't have access to health care. We're going to have to wait and see how it's prioritized, but it certainly, I think, will be prioritized initially at the highest risk population.
Okay, Dr. Marla, thanks for that.